Hi class, this is Dr. Kaufman, and this is the second lecture for week 1 of CNL-500. I'm covering psychoanalysis and the counseling theory of Sigmund Freud. So let's go ahead and get started. My goal here is to spend a short amount of time on every slide just to give you some of the information that you would be receiving from me and from the classroom discussion if we are all physically attending Grand Canyon University here in Phoenix, Arizona. However, we're not. This is for an online class. So this lecture is here so that you get some of the interaction from me that you would have gotten, and also so that you can put my lecture together with the textbook and feel like you're fully exploring psychoanalysis. Now, Sigmund Freud is the original psychologist. He's the reason that we have a field. He's the reason that counseling became an offshoot of psychology, why we have state licensure. Really, it all starts with Sigmund Freud and what he wanted to accomplish with being able to explain the psychology of people, their psyche, and different elements of the human condition. I've constructed a timeline here that comes straight from the textbook, and basically it talks about his journeys across Europe and who he worked with. His time studying hypnosis, his time interacting with other members of the psychological community, such as Alfred Adler and Carl Jung, and how psychoanalysis really became the starting point for psychological treatment of people across Western Europe. So this set of concepts really grew inside Sigmund Freud starting in the early 1880s all the way into the 1900s. And so it's just a good idea to understand that he was the main game in town for psychology. He started a lot of these concepts. These days we look back and we don't like a lot of his concepts, or we think they're incomplete. But back then, these were the only ideas to consider. It was all a brand new field. It was a new way to conceptualize the person. And so, of course, you would hope that 100 years later we have some better ideas than those original ones. That's how ideas evolve in academia over time. But back then, we owe a lot of appreciation to Sigmund Freud for his dedication to a lot of these principles and how they became clinical interventions and psychological techniques. And then this is a concept that's going to come again later in the PowerPoint that I'm presenting, but it's the iceberg model, and it really is used to explain the difference between the conscious and the subconscious or preconscious. And so we are only aware of a very small percentage of the activities that go on in our own minds. The rest of it is beneath our recognition in the unconscious level. Just like an iceberg, the bulk of an iceberg exists underneath the water and you can't see it. And so we have the ego, which is the part of our minds that really is trying to mediate between what is right and what is the basic urge, what's instinctual, what do we want versus what should be. And the ego kind of keeps score and help us move throughout our daily life. And it negotiates between the superego and the id. And so that's sort of the main conflict that we're trying to resolve in psychoanalytic theory. And this is what motivates us to do something or not do something. Does it meet a basic impulse? Does it fulfill a sexual urge or an aggressive urge? Does it help me feel more comfortable, complete? Does it help me have the right kind of energy? But also, do the rules of society allow me to do this? Is this right or wrong? Is it okay? And then even if it's not okay, is it something I'm still going to be able to do? Am I going to be able to do this and manage a positive distinction about myself? And so the ego is really the one in our conscious. We watch that tug of war happen between the superego and the id, and then we decide our actions based on those motivations that result. And the ego is the part that is in the conscious level of recognition. Sigmund Freud also identified several basic constructs for the urges that we experience. There's the eros, that's the erotic love, that's the tendency to take action that leads to life, reproduction, things like that, procreation. There's the libido, which is more of our psychic energy for engaging in work and play and leisure activities. And then there's the thanatos drive, which is our death instinct. It's the destructive behaviors, things that we have to tear down and overcome and defeat. Anytime we hit our fight or flight response, our fight instinct comes from the thanatos drive. If these go out of balance, then you end up being what psychoanalytic theory calls dysfunctional. So the goal of the theory is really to have a good balance between these three motivational drives. And again, here's another iceberg. And it's just there to reiterate that 10% of our conscious mind, that's the ego. That's the negotiation between the id and the superego. The rest of what we experience in our mind is unconscious. We may not even notice it. And Sigmund Freud thought therapy was an opportunity to access the unconscious and to interact with the superego and maybe our repressed drives and our motivations that we're not able to act on. And so we are aiming through this therapy to make what is unconscious come into the conscious realm so that we can interact with it, interpret it, and use it. And then again, here's the conflict. I have addressed this a few times in previous slides. The ego is there to keep score, resolve the conflict, see which one makes the most sense, and go into action on it. And this is based on the information that's coming into the body, coming into the psyche, and how the person is interacting with them. Do the rules of society win out? Do the needs and wants of the present moment that I'm feeling win out? The ego is there to help the person go from just thought and conflict into resolving that conflict and acting in reality. So without the ego, you're just thinking about stuff forever. Nothing enters into through the reality principle. So the id cannot always get what it wants, and the superego cannot always get what it's pushing for. The ego is there to help decide what is the ideal and how do I act on this. And then if you have a tendency that is not being fulfilled, you may go into a repression, which is where you know something's unacceptable and you seek to not exhibit it. So things like sucking your thumb in public. As a child of certain ages, that's okay. When you get older and you're in elementary school, your teacher may notice it and say that's not age appropriate and say you have to stop it. And so the child may repress the tendency even though they really want to suck on their thumb. There could also be a fixation. And so you hear similarly with that oral fixation from sucking your thumb. If that's repressed, then some people may start smoking later in life because that's a socially acceptable or unacceptable, but more acceptable way for grown-ups to have something that they're constantly putting into their mouth. And so these fixations and repressions occur at different psychosexual stages, which is the model of human development that spirals out of Sigmund Freud's work. And there's 4 stages here on the slide. The oral stage, which is where everything, the pleasure and the calm, the comfort comes from things being present on the mouth. The anal stage, which is from ages 1 to 3, and that's where the pleasure and comfort comes from the child being able to control things in their environment, such as the release of materials that go through the anal canal. And so that's why it's called the anal stage, because the joy that Sigmund Freud conceptualized comes from being able to decide whether things flow in or are held, or flow out or are held onto. And then there's the phallic stage, which is a little older, where you start to realize that you have different genitals than the other gender does, and how those work. And those are a source of uniqueness. And those are private. They belong only to me. So maybe there's some shame about sharing that with other people. And you learn about what is yours and, you know, what is okay to share and what is not okay to share. What do you keep just for yourself? And then age 6 through puberty, you have the latent stage where you don't really interact through the phallic stage anymore. Your genitals are not really the main event anymore. You're just really developing as a person and moving into adolescence. And then you hit the genital stage. So that's the 5th stage, not in a square here, where you start showing sexual interest and desire towards the other sex, normally, according to Sigmund Freud. And you also start to experience all of the more adult version of that stage. And, you know, it goes up and down in terms of how infatuated you are with expressing yourself through your genitals, but it's part of the adult stage of development, according to Sigmund Freud. And so that's just another activity you're able to act on, and you have the psychological desire to do so. All right, so that concludes our psychosexual stages from Sigmund Freud, all 5 of them. And let's go ahead into the next slide. So any symptom that you experience in psychoanalytic theory is the result of a psychic or intrapsychic conflict. And so basically anything that you experience that's not good, like uncontrolled vomiting, that means that you would have a desire for morning sickness, which means you wish you were impregnated if you're a female, okay? So that makes sense, right? We have Jim from The Office kind of looking at these kinds of generalizations, and they really don't make sense. But if everything that you experience is coming from a psychosexual event or motive or desire, then everything that you experience that feels comfortable means you're experiencing those stages productively and effectively, and anything that's uncomfortable has to do with some psychosexual conflict that's going unresolved. And so for the male side of things, you'll see option 3 here, arm numbness, not being able to feel your arm. He would interpret that as saying that you masturbate too much and you have a desire to stop that and you're not being successful at that, and so your arm is going numb as an internal way to resolve that conflict and say you're not masturbating right now. So, both genders get their equal kind of nonsensical interpretations, although females do get a heavier dose of that throughout the entire theory, because Sigmund Freud didn't really have a lot of the feminist concepts that we have now that would have helped for some of his ideas to be a little bit more balanced. But as you'll see here in this chart, you can pause this if you want to look at it. This chart here is an explanation of a lot of the other defense mechanisms that spiral out of some of those dysfunctional processes that were being explained in the previous slide. So things like denial. That's when you realize that something in your reality is painful, and so you tell yourself the opposite story so you don't have to deal with it. Or repression means, I need to forget that, so I'm just not going to remember it. It's not part of my story or my narrative anymore. And so, all of these different defense mechanisms come from different clusters of symptomatology like narcissism, immaturity, anxiety, or even maturity. You could have humor or sublimation as a way to express your maturity, but in a more socially acceptable way to bypass some of those superego rules that may be crippling. Now, as far as human development, we've already described the psychosexual stages that are exhibited again in the picture on the right, but on the left we have some complexes. So you may have heard of the Oedipus complex, where a child will have a deep love, maybe even erotic desire for their mother, and go into a feud with the father figure, fighting for the appreciation of the mother. So we have the story of Oedipus from the some of our earliest literature works from ancient Greece that depicts the Oedipal complex, the desire to kill your father and marry your mother. So that comes from some Jungian concepts, and Jung was, of course, working with Sigmund Freud early in their careers, and founded a lot of the basic ideas of psychoanalysis together before they split off. And so that's how we have concepts like the Oedipus complex. Another part of that complex could be the castration anxiety that the child will feel when they realize the father is dominant to them and could cut off their genitals as a way to make sure that they never steal the compassion and the interest of the mother figure. And so these human development stages, of course, hopefully apply to younger ages. But these are some of the early concepts from psychoanalysis of how we understand people developing. We start out with these conflicts, we seek a way to resolve them, and then move on to the next stage. And then, of course, the part of our body, the part of our psyche, the part of our growth that gets the focus from section to section, of course, changes with our age range. Now, healthy individuals are able to love others and work effectively in this theory. So if you're not doing well at your job, if you're not interacting with other people effectively, if you can't generate the compassionate feeling of love, then psychoanalytic theory says we have something to resolve through psychoanalysis. Now, psychoanalysis is not the exact same thing that we think of when we think of a counseling session. And so the person is usually laid out on a long couch, and they are not facing towards the counselor. The counselor is not in their field of view during psychoanalysis. The client is just talking. And there's very little back and forth questioning like in a regular counseling session. But the psychoanalyst is sitting there with the desire to keep the person sharing their stream of consciousness and just exploring their subconscious ideas that are rising into the conscious. So it's not the same as what you might think of in counseling. If I have a counseling session that I'm able to upload to my YouTube page so you can watch it, then I definitely will do so before the end of this week of the course, but I can't guarantee that that's a possibility at this point in time. So just keep a lookout in the main forum if I am able to post something. Now, according to Freud, if you don't have a dysfunction by the age of 6, you're all clear and you're going to have an effective life. You don't need to worry about your repression or your intrapsychic conflicts. One thing that he did a lot of his focus on with his clinical work was working with people who experience or exhibit hysteria and people who exhibit obsessive compulsive neuroses. And there are also a few other issues that he helped to resolve too, and we're going to talk about those in a little bit. Now, there are 3 types of anxiety that Sigmund Freud identified: the neurotic type, the moral type, and the realistic type. Now, the realistic type is not the kind that you engage in psychoanalysis from. It's appropriate and it makes sense. So you experience this anxiety in order to flee a real and present danger. The moral is where the superego just locks you down at every point in time and doesn't let you function in a real society, because the pure ethics of moralism that the superego tries to aspire for are not always realistic. So this is an example of someone like Chidi from The Good Place, if you watch that television show. He would have that overzealous moral compass in his ethics. His superego is hyperactive, and so that creates an anxiety. Now, the neurotic person, this is a person who is fearful of releasing all of their libidonistic energy. So this person is so engulfed in the actions of their id that they could cause harm to themselves, their situation, or others involved in their situation. And so that creates an anxiety or a worry that you're going to lose out on your situation or your safety or some of those other things. So those are the 3 types of anxiety that psychoanalytic theory sought to address back then. Hysteria has 2 types: conversion disorder, which is where a physiological symptom is experienced because of a person's psychology. So think that arm numbness because of excessive masturbation from the previous slide. That's an idea that explains a conversion disorder. And also phobias. So a powerful fear centered around a specific thing, like fearing the expression of your libido or sexual energy, or fearing being around people in public, like an agoraphobia. That's a phobia because you can't push yourself to exist comfortably in a scenario where you're around that feared stimuli. This could be related to the anal stage or other stages of psychosexual development. And so you just have this, the thoughts of the mind are centered around a singular concept and you can't push yourself through it. So that's something that you have a reaction formation or other defense mechanisms come up because you cannot get your mind to focus on what it should be focusing on. You're focusing on the obsession or the lack of control revolving around that obsession. There's also depression. There's 2 kinds of depression in this theory: melancholia and mourning. Mourning is, of course, the loss of a person or a situation or a cherished object. And melancholia is more like major depressive disorder as we would understand it now. So this is where the superego is constantly shooting down your self-esteem potential and saying, you're terrible, you're worthless, you're never going to be, you cannot. So the superego has all these rules, or society can't let you, or you're not allowed to. And so then the ego just cannot balance between the desires of the id and the hyper overactivity of the superego, which results in a depression. Then there's also dementia praecox, which is what we would call today schizophrenia. This is a fractured psychology of the mind. So multiple personalities or extreme paranoia that interferes with moment-to-moment life situations. And this is something that existed back in those early 1900s also, and would result in people having the opportunity to go do psychoanalysis to try to resolve that conflict and reunify the psyche, which, if you bring enough of the subconscious into the conscious, resolve it, cease the conflict, then Sigmund Freud would say that is possible. Now, for assessment, psychoanalytic theory engages in informal assessment. What it does is it accesses the parts of the person that they're able to share. It reviews the content that's being shared in the session, either from dreams or free associations or errors that are being resolved. We see over here some ink blots depicting some Star Wars characters or DC Comics characters, depending on if you see the Joker or Batman, or if you see the Stormtrooper or this other smiling kind of creature. So you want to understand that a lot of these ideas, the first thing you see is your reality. The first thing that you project into a thing when things are just random splotches of black on a white background, that indicates what you have going on in your psyche. And that's what Sigmund Freud was helping people to resolve and understand, is to help them to take their symptoms, bring them into the conscious so they can actually experience them and overcome them and understand what the real problem is. Because a lot of times he conceptualized that people's original problem is not the actual problem, that they're worried about these other things in the unconscious. Now, another part of what Sigmund Freud would do would be to use hypnosis to bring some of that unconscious into the conscious. And so we see here an example of the setup of a room for a psychoanalytic session. Now, obviously in hypnosis, you're face-to-face with the person. But in psychoanalysis, this is where the client would be laying down facing the opposite way and just sharing their flow of their conscious. This is the analytic couch method. And then this is something that people do a lot. This is not once a week. This is not twice a month. This is 3 to 6 times a week that you're sitting down for 1 or 2 hours doing a psychoanalytic session. So if you really want a good business model and you can get people to believe that you're a guru of psychoanalysis and that's the kind of therapy they want to pay for, you can be set with 3 clients, honestly, because a mild case will come to you for 3 sessions every week. And a severe case, or a normal case even, will come 6 days a week and just have that 1 day for the weekend. So the idea is to share, engage in catharsis, to clear away the emotional baggage connected to these unconscious principles as you're sharing them in session, and for the psychoanalyst to be sort of an observer and help guide the person through additional digging through those unconscious motives and worries. Another thing to consider is there is a power differential in psychoanalytic theory. So the therapist here is going to work on overcoming that resistance and helping the client to have thorough and acceptable interpretation of what they're saying. So the psychoanalyst is determining what is real and what is unreal, what is correct and what is incorrect. The client's role is to sit there, lay there, and share and honestly explore unconscious things that are being revealed through the therapy process. The client must comply with the direction of the therapist. So although the therapist is not going to try and interject and skew the process of psychoanalysis or contaminate it, they are going to be there to tell the client what is what and explain the theory and explain the truth of what is actually being shared, to share the expert interpretation. So the unconscious is why the patient is the patient, and the patient did not lead a life where they became the psychoanalyst, which is a really interesting way to think about it. The psychoanalyst is there to preserve the integrity of the psychoanalysis and for the client to go on that journey during their sessions. The goals of psychoanalysis is to uncover inner problems disguised as symptoms, to promote the successful integration of the subconscious principles back into the psyche of the client, to uncover the sources of pain from the client's history that they may be accessing through their dream analysis, reviewing their personal history, exploring their subconscious, and then also to discover the obstacles that get in the way of appropriate life choices and to help the client to cease making those poor decisions and take action for themselves. So this is where you point things out and you tell the client what is truth, what is real, what is necessary in order for this psychoanalysis to be successful. And the process of therapy occurs in the two processes here on this slide. So the opening phase is 3 to 6 months. So let's say you're coming 3 to 6 times to your psychoanalysis, and the opening phase is 6 months long. That is a long time for a person to be going to therapy before the opening phase is over. But that's how psychoanalysis works. That's how important it is to thoroughly explore the unconscious that's being revealed through the therapeutic conversation. And then you develop transference. What is the therapist? What does the client believe about them? What is the reality of that interaction? And then if there is resistance, then you have to work through it. You don't just abandon counseling, that the client is stuck working through it. They cannot abandon the psychoanalysis. And then you resolve the transference, and that leads to growth, and that leads to clarity in terms of understanding those subconscious principles that led to the resistance, the transference, so on and so forth. The whole time you are aiming to develop insight, overcome resistance, and effectively, efficiently, accurately process the transference and countertransference that's experienced between psychoanalyst and client. So transference is where the client's feelings from a significant other person are transferred onto the counselor. And countertransference is when the counselor's feelings toward a client are coming from a different relationship in their own life, or that they're picking up on that resistance and returning the resistance back to the client through countertransference. We want to resolve both of those. And this is not just to psychoanalytic theory. These things are not good for any counseling process. You want to be interacting appropriately and professionally with your client, no matter what theory you're utilizing. And you want to help the client address their own transference so that they can give you a fair opportunity to be their counselor. So always stay aware of whether an interaction in counseling is an example of transference or countertransference. That is a very important prerogative to stay in command of as the counseling professional. Now, some techniques that you're going to want to understand of this theory are free association. So if I say a word, the very first thing that pops in your mind, that's your free association. So let's try that. I'm going to say a few words, and I want you to write down or type on your Word document the first word that pops in mind. Deadline. Red. Tall. Paper. Counseling. Parents. All right. Now, all of those, I gave you a few seconds to do your free association, but you all would have had an instant word or thought that pops into your head. That is called a free association. There's also the interpretation. So a client gives you some phenomenon that they're fixated on, and you interpret it for them. The other thing is to work through and analyze the resistance, engage in dream analysis, and analyze transference also. So these are all techniques that belong to psychoanalytic theory. When we choose to use them as counselors, we're using a bit of this theory. Now, here's another slide. We would have a participant from the classroom face the class, not face the PowerPoint. And then I would actually reveal the words, and we would do the free association test with that client. And then we would review some of the motives and the themes that come about from that free association test. And as Sigmund Freud said, the fundamental rule of psychoanalysis is the client is to reveal everything that comes into his head, even if it is disagreeable for him to say it, even if it seems to him unimportant or actually nonsensical. And that's from Sigmund Freud in 1940. And so the idea here is time, death, red, mother, fear, home, school, friend, love, hate. All of these ideas have an instant projection that the person would take as they're freely associating with those words. And then, of course, with the analysis of the resistance, you want to analyze it and address it so that it doesn't become a sabotage to the process of psychoanalysis. For dream analysis, I have a chart here. If you want to pause it, please look at this chart. This is a list from the textbook of some of the things that these things represent in a dream. So if you see the number 3, then that could mean that your dream is interpreting some fixation on male genitals. Flying is an interpretation of an erection. dancing is an interpretation of the desire to engage in sexual intercourse. So you can see what Freud was focused on explaining with his theory. And yet, sometimes there are symbolic representations of some of these things. For example, water is widely understood in dream analysis to understand life, the source of life, the flowing of water, or spouting of water could relate to the climax event during sexual intercourse. And so, there are a lot of dream analysis concepts that over time seem to be more valid and more accurate than you would actually think. So that's something interesting to think about, is although it's outlandish and hyper-focused on sexual organs and sexual principles, it does seem like there's some merit to some of the symbolism in these things in certain scenarios. Now, I have explained these other interventions with psychoanalysis already, and I know that this lecture is ending up being quite long, although in the classroom we would keep going. I've explained why the analysis of the transference is important. Now, in terms of evaluating psychoanalysis in research, it's difficult to do this because a lot of it is conceptual, psychological only. It's not behavioral, it's not observable. And so there's always questions of the empirical validity. However, the theory has preserved itself over time. It continues to evolve and to still be useful in certain scenarios in the treatment processes that we engage in as counseling professionals. So it's not a good idea to dismiss it, but it is a great idea to understand why research might have a hard time stomaching psychoanalysis. So, of course, because it's one of the oldest approaches that we can fathom, it is, it is researched, but the kinds of research that we look to in terms of validity and reliability, it's hard to identify exactly where psychoanalysis falls in terms of the efficacy of treatment. Weekly psychoanalysis, though, does have positive effects on the behaviors of the individuals engaging in it, and gender outcomes are pretty much the same that we found over time, that it doesn't prove to be more effective with one gender over the other. And so you just want to look at the kind of case that's being worked on and make those gender-based distinctions or generalizations in a mindful way. All right, so research concludes that there are limitations to Freud's concepts in the present time, of course. We had that slide with Jim from The Office kind of saying, of course, that's how it works, right? There's just some ideas that are outlandish and don't seem to fully work in the, 21st century environment. Now, there's also research that identifies that Freud's concepts are biased, of course, and then some of the foundational points of the theory are, difficult to purely use, although some of the ideas there are a good starting point. So that's really the review of how this theory works. Psychoanalytic theory, it just, it doesn't treat the genders equally in terms of the concepts, although some research indicates that it works equally well in certain scenarios. Sexual motivations for conscious and unconscious human behavior are unbalanced in terms of how the theory interprets males versus interpreting female behavior selection. There's a class bias, of course, if you are dealing with poverty or have limits to your funding or even use health insurance to go to therapy, you're not going to really be engaging in psychoanalysis because you need too many sessions, it's too costly. And also it's a Western European set of concepts, so it isn't designed to work with every concept out there either. So Freud created an elaborate theory to get psychology started. We owe a lot to him in terms of our field existing, in terms of psychology becoming the scientifically founded series of principles that it is. And we also owe a lot of his theory to how we understand the progression of human development. Even though some of his theory concepts we might have discarded at this point in time, the psychosexual stages do seem to work. And there's also concepts in his theory that seem to work once you get past the things that are nonsensical and aged poorly, to the modern context. So that concludes our video on psychoanalysis. Thank you everyone who's still hanging in there. Remember, class would be 4 hours long every week, so giving you this 40-minute video to review psychoanalysis plus the other video to review how theories work and some of the other things that I do put into the classroom. It's just my desire to help the online class feel more like the traditional version of taking CNL-500. I hope you've enjoyed the video. I hope psychoanalysis feels more clear, and I'm looking forward to reviewing your papers this week. Thanks, everyone.